My name's Kendall. A little bit about me is I am a 21-year-old student. I'm about to graduate in December from Grand Canyon University. I'm taking this class because I just needed 4 elective credits for Grand Canyon University to let me graduate in December. And with that, I was like, well, if I'm taking 4 elective credits, I might as well make it fun and something useful, something that I'm interested in. I've always been interested in sign language, but I never really thought that I could, make it work or learn it, or that I had the capability. But I figured, let's just go for it. I really want to learn American Sign Language because it kind of opens up new doors for you. So, a little bit about my work. I've worked with an 11-year-old autistic nonverbal boy for the past year and a half, coming up on 2 years almost. And I love him to death. He doesn't talk because he's nonverbal. He completely understands everything that I tell him. He's very smart. He knows. The problem is that he just can't get the words out. He knows what he wants to say up here, but there's a miscommunication between the brain and the mouth, and it just doesn't come out. So we do a lot of things with him to help him communicate a little bit better, like giving him pictures of things that he likes, and he can pick what he wants to do. Other things we do is we try to incorporate a little bit of sign language where we can. I don't know much, but we do teach him some words like more. So if he's still hungry after he eats, he'll say more, and we're like, okay, you want some more food? We'll make that happen. Things like that, sleep, eat, things like that, things that we work on. So learning American Sign Language would really help him to communicate better, which would be awesome. My other job, which is my primary job, I'm a full-time tech in the emergency department at Banner Del Webb in Sun City West. I love this job. It is awesome. The issue that I run into very frequently is in the emergency department we have a variety of people, different backgrounds, different cultures, different languages, which creates new barriers that we don't always have to deal with. So learning American Sign Language would really, really help me be able to communicate with deaf people, because we use a machine called a VRI, which is a video interpreter. You select the language that you need, you call them, and they interpret for you to the patient, which is awesome. It's great. But there is something a little bit different when you have a person standing directly in front of you who is telling you exactly what your treatment's going to be, with no one in the middle. So it's straight from the horse's mouth. It's a little bit different. So I would really like to be able to eventually one day be that person who can kind of stand in the gap and be able to say, hey, this is your treatment, this is what we're going to do, and here's how we're going to help you get better. It truly is a good thing and something that I want to do. So I guess I kind of answered the question if I'm planning on using American Sign Language in the future. The answer is yes. I plan on using it. If you don't use it, you lose it. So after this class is over, even though I'll be graduated, I would really like to take the second part, and the next part, and the next part, and the next part. I really want to be fluent in this language because I really want to be able to communicate with people of the deaf community and other signers. It's just really interesting. So experiences that I've had with deaf people, I've actually only had one, and that was about 2 or 3 weeks ago in the emergency department. This woman came in. She was just having a lot of pain, and she was deaf. So as a tech, I get to do a whole bunch of things related to patient care. I do IVs, I get blood work, I do urinary catheters, get vitals. I mean, I do a whole lot of things that help make the nurse's job a little bit easier. So that being said, I go in to start the IV, and the nurse is walking out, and she says, oh, by the way, she's deaf. I already talked to her through the VRI. The interpreter told her that we were going to do an IV and get blood work, so you're good to go. It's like, okay, great. So I go in, and I just immediately felt really uncomfortable because I could not communicate with her the way that I wanted to. I just go in and I'm completely silent. I don't know if it's, rude to mouth words or not. I figured maybe it is rude and I shouldn't do that. So I really tried not to, but it's hard to avoid doing that when that's something that you're used to. I have a routine when I go into a patient's room. I go in, I introduce myself, I tell them what I'm going to do, what I'm here for, and why we're doing it, and I kind of explain it to them. And then I ask if, they have an arm preference for an IV, because they know their bodies a little bit better than I do. But with her, I couldn't do that, and it really, really bothered me because I felt that I could have given her better patient care because I just go in completely silent. I just kind of, looked at her when I was about to start her IV. But even though she knew what I was doing, she didn't know exactly. She didn't get to know me, and I guess that was, um, the most regretful part on my end. So in the future, I'm really just gonna try to keep practicing ASL. Once I learn it, I really want to keep it and I want to use it. So I like to be an interpreter in my spare time for hospitals, things like that, and even in my own field when I'm a doctor, I would really love to be a registered interpreter with the hospital, being certified and being um, labeled able to interpret patients on my own and be my own interpreter. So I really love that because you don't have to go through a third party. They're hearing it straight from you, which is, in my opinion, way better than having to go through a third person. Overall, it's better to be understood than not understood, but it's always better to limit the number of people involved in your care if you can. So that's a little bit about me and why I'm taking this class and my intentions for American Sign Language. But I'm really looking forward to this semester and I can't wait to get more involved.